right, guys. I'm Lacey, nurse here at the AGC, and we have a awesome patient here for you for a video. He actually offered to do this video, and I love it when you guys, I'm on the phone with you and you say, hey, I know you from these videos, and I think my case would be cool, because you did that for me, and I appreciate it. Because that's how you guys learn about us, and we were just sitting here talking about how you came to find us, because you got on YouTube, right?
Yep.
And you searched us out?
Yeah.
Or you just type in gynecomastia? How does that go down?
I looked up the surgery for gynecomastia, specifically for unilateral, and one of the first videos, and a couple videos to pop up, was Westlake plastic surgery. And seeing the procedures and how they went really made me confident to come here. I flew all the way from Florida for that reason.
Yeah. Cool. Well, we appreciate having you, and we are lucky because we do have people come in from out of town. So he's our third patient today, and we usually do about 3 surgeries a day. And the patient before him came from South Carolina.
Wow.
Pretty cool. Yeah. So we're blessed to have you guys, seek us out and fly here and do all this to let us take care of you. But you did mention it's a unilateral case, so it's we see a lot of it. But it is still interesting when you see a case like his, where it's just one side that's much more prominent than the other. Dr. Creedy is going to treat both sides for him, just to make sure we get a smooth, even contour. And a lot of people will ask, hey, why are you treating both sides? But it is to make it more symmetrical, And I think you've even said you have a little bit on the other side as well.
A tiny bit. It's not much. Like, if it was the same on both sides, I probably wouldn't need treatment, I would feel like. But also, who knows if that gland could start producing as well. So
because this came on fairly quickly, right?
Yeah, it came on about 6 months ago, and I'm
so fast.
26, so not using any hormones or anything. So it's very sudden, and I made an appointment a month after it came on, just because I wanted to get it taken care of.
He didn't wait around.
No.
That's good.
And it's gotten a lot worse in the past month especially, so I'm glad that I did.
Really?
Yeah.
Okay. And worse, do you mean size, or do you mean, like, is it painful to you?
Not painful, but tenderness. I mean, I haven't been able to wear any of my shirts that I usually wear, besides with a brace. I was using actually an abdominal brace to make sure it wasn't showing through, because that one nipple would show through all the shirts, and I'm self-conscious about it. So.
Of course, yeah, it totally makes sense. Well, I'm excited to get to take care of this for you today. Is there anything that you had questions about that you didn't feel were answered in the videos that you've seen?
I didn't see anything that, like, I had questions about that you guys didn't answer. I mean, the video, especially the one post-op, is really useful.
Good.
And, I mean, I know when I'm waking up, I might need a refresher on some of that, but it was nice. Like, everything made me so confident to come in here.
Good.
What's crazy is I confided in a friend from the gym where I work out in Orlando, and I told him about it. He's like, oh, I actually had the same procedure. It's not bad. I went to Austin. Like, no way. He went to the same surgeon. He went to Dr. Creedy. So it made me crazy confident that I chose the right doctor for this. Yeah.
Wow. Yeah. That is awesome. I don't even know what to say about that. You're in freaking Orlando, and you find somebody
Mr. Worldwide.
Yeah. I mean, it is true. Micah, we need to put in this video the map again, because we haven't shown it, I don't think, in a while. We do have a map on our way in our hallway on our way to the OR, where we have patients put in a pin from where they're from. We got a lot of good Florida patients in there, and I always think it's cool because it really makes you feel how big the impact is that Dr. Creedy is making on the world of gynecomastia, and people fly here, so it's pretty cool. And when are you leaving?
We're leaving tomorrow, so I'm coming in to make sure.
Yeah, we'll see him in the morning so we can show you guys his early result. Since he is from Florida, it's not like we're going to make him come back in a month or so. We will keep up with him. He's going to call us, we're going to email, that kind of thing. But we don't make him come back. So if you're considering coming here, you don't have to come back for any visits unless you need us. And you probably won't. So that's good.
Plan. Awesome.
Yeah. All right. Well, let's take a look at your chest here. All right. And then go ahead and rest back on this chair right there. There you go. Okay. All right. So can you come in here, Micah? Let me move this chair for you. All right. So obviously we have our more prominent side. And if you can see, we've got like, it's literally puffy nipple. And I'm going to go ahead and grab you here, so I'm sorry.
Go ahead.
So I can feel it literally behind here. So about right there is where it is, okay? And it's forcing this nipple out, you see? And then this one, so let's see. You do have some over here too.
Yep,
yeah,
a little bit.
Yeah, this is way localized right behind this nipple here. And so you can almost see that he had probably an inverted nipple at one point where it just kind of goes in instead of out, and it's pushed it almost all the way out. And so this will be amazing. The incision will just be down here at the base of the areola. Get this flattened up. Flex your chest muscles for me. Yeah, it's right there. And when you flex, I feel like you can literally see right there. So we're gonna smooth this out for him. Do it again over here. Yep, just that little bit. I do like to describe how I feel like the process goes when you have general anesthesia. So it's almost like you go to sleep for 5 minutes. So you'll go back there, we'll give the IV, and then Dr. Wilson starts putting in some of your medication, and then you just kind of drift off to sleep. It's not like an abrupt thing. You're just kind of relaxed, and then you go to sleep. And then you wake up, and everybody says, it's over already? Because it only feels like 5 minutes of your life. Like you had a really hard nap for 5 minutes, and then you're awake. And a lot of people will be like, I wish I would have known that it was going to be like that, so I wouldn't have stressed so much coming into it. And so I feel like that's important to note. So, okay, guys, I'm excited to get back there to the OR so we can take care of this. It's going to be done in an hour, and then he'll be on the other side of this and can move on with his life. And then we'll get to see him tomorrow and see how good he's doing.
Cool.
All right.
Okay, so we're going to talk a little bit about unilateral today. So I take his shirt off, and immediately you can see he's sort of creased over. You can see this crease right here. That's kind of showing you that he's bending over in his chest. This is Natalie, by the way.
Hello.
And Natalie's our in-office expert of all things. So come on in, Nat. Feel free. So what I see him right now, he's all closed down, and his shoulders are back, and he's actually flexing in the mid-upper thorax in this area, which is really common, and that gets to the whole posture thing. So if you want to see something cool, sit up straight. Woo! There, even better. So look at him now. Okay, now slide back a little bit. Yeah, push yourself back there. And so, there you go. Yeah, get yourself back. So the moral of the story is that I'm a big posture guy because a lot of the improvements that you're going to get into the chest when we're done is really the posture. Now, he has great skin, and that's a huge bonus. So unilateral doesn't mean anything funky per se. So why did it happen on one side than the other? I don't know. And if anyone tells you they know, they're just guessing. And I don't really guess. I just tell you, I don't know. The moral of the story is just no different than any other gynecomastia. So that's the good news. He has a puffy nipple on this side. As you can see it through here, I can feel a mass under over here. And I can look at this side and I can say, well, you know, and I get a lot of this online that they say, oh, well, I'm normal on one side and I only need one side. They say they only need one side treatment. But the problem is the number of people that I do on one side is almost like negligible. Yeah. Why? Because despite what you think, I can feel this, I can feel this too. So he hasn't gotten the whole puffy or the herniation. And this is really kind of a cool look here. So this is more of a normal areola, although it is a little bit puffy. But this one clearly is puffy. This is herniated. So the tissue that's behind here is actually pushed through the areola, and that gives it its herniated appearance. So some docs may say, hey, you know, you got two different ones. We got to do something. I got to make a circular scar. Absolutely not. Remove the stuff that's underneath there. Treat both sides, and it's going to be perfect. We have nothing to worry about. So that's the plan for today. So one of the things I want to, again, emphasize that oftentimes you need treatment on both sides, fellas. It's not just the one side, because otherwise it's not going to look normal and all that kind of stuff. Other than that, he's in great shape. He's going to benefit tremendously from this, and it's actually super, super cool. Where are you from?
From St. Louis, but moved down to Florida when I was 14, so I've been there since.
Good old Florida. Yeah. You give me a marking pen?
Got you right here.
Oh, you got, look at this. My videographer has my marking pen. So as usual, I'm going to mark the epicenter. It's going to be where the nipple is, right over here. Okay. This area, it's a little bit more diffuse, which is kind of interesting. The marker may even be bigger, but you don't have the I'm going to use all blue today. But I'm going to contour all this area here because if I don't, it's going to look odd. So you'll see when I remove this main area here, if I just did that alone, it'll have a sunken in appearance. So I have to contour it all up so that it looks nice. But that's also going to give him better definition of his pecs and all this kind of stuff. Dude, flexing. You got any questions?
No, I wanted to tell you something really interesting. When I confided in somebody in the gym about the procedure, he told me that he had it. And funny enough, after I had already made my appointment, he had it with you.
Is that right?
Yep, he had flown as well all the way from Florida.
God, yeah,
it was a crazy coincidence, but it makes sense.
Yeah, no, it makes sense. And it's just, it's really cool. I mean, I'm so lucky to have people from literally all over the world. And I have more, as I keep doing this, and I do 450 cases a year, and I've done almost 5,000 of these, there's a lot of like cross-pollination now, which is really super cool. And I always discuss with my patients, please help other people out. You know, the whole brotherhood, the concept of, we don't like to talk about this, and it's not something we share it, but he did, right? Mm-hmm. And whoever did that, thanks to him for sharing, because it just helps. It's nice to know that A, it can be treated, and B, it was treated by someone that you feel did you right. And that's sort of what we're all about here. And we appreciate you being here and all that kind of stuff. And hopefully you'll tell other people.
Oh, I will.
Yeah, because in Florida, you're off with your shirts more often than not because you got the beautiful beaches and you got all that stuff.
Oh, yeah.
And so more reason we want to make these chests real nice. Micah, do you have any questions?
I don't have any questions.
Your videographer looks like he's holding some kind of contraption from like Transformers, doesn't he?
It is.
Yeah, it's all good. Okay, so we're going to get back there. We're going to fix him up. We'll show you the immediate results, and we're going to take it from there. So we're rolling here, and I've already done some vaser ultrasonic liposuction, and I've done some traditional liposuction. And I really want to focus a little bit on the artistry of this whole endeavor. We've got more tissue on this side than we have on this side, but he's definitely got some tissue here. So the art really is to sort of get this sort of symmetrical. So I'm not trying to overly sculpt his chest. He's got fat, but kind of want to preserve the body sort of morphology that he has. Got good muscles. I don't want to overly kind of do it, but I have to get this mass out of here and then make it look good with the surrounding area. So I'm only going to do as much liposuction as I need to do. It's the art component, the artistic component of this procedure to kind of get it right. What a concept, right? And I only say this because some of the guys are like, I don't need liposuction. Look, I don't want to do liposuction if I don't need to do liposuction, but if I got to do it, I got to do it. And I got to do it to make the result look good. He's going to have a mass, obviously, on this side that's probably more, I would just say, more glandular than the other side, because I can feel it through the skin. We know he's asymmetrical, and this is a little bit bigger than the other. Sometimes it's a fine line between what we call unilateral gynecomastia and really asymmetrical, splitting hairs and sort of, to some degree. Since you have to really treat both sides usually, why don't you just call it asymmetrical, really? And gynecomastia, asymmetrical gynecomastia, or even unilateral gynecomastia, if you want to split hairs, is, we have patients there that had like really a full-on, breast. And remember, the top-down approach that I do is, you can see how superficial my scissor is here, because I'm removing all the tissue, all the gross tissue, okay? And then you can see the scissor through the skin here. So thinner skin contracts more, which is a good thing, because I want this areola to go back. And remember what I mentioned is that he definitely will not need a circular scar around there. It'd be hard actually to do that circular scar and not leave tissue. If you're aggressive the way I am, and I can feel it's so much thin here, and then you make an incision around the areola, you can jeopardize the blood supply and have a dead nipple. Which, not going to kill you, obviously, but it's probably not something you're looking to have. Yep. He's pretty stuck. Da-da-da. And he's a flipper, which means that you don't want you remove the attachments to the surrounding tissue. It generally just kind of flips out. And that's what you're seeing right here.
Is that easy, or like, would you say a flipper's like?
Yeah, I mean it's just a different way it comes out. I mean, I guess I've done too many of these, and we start observing things that more.
It comes from the bottom.
It's just we just.
Kind of
Is
flips
that your
out.
term, or is that a technical term?
No.
Oh, taking.
Oh boy, I don't know. That's my term. We have to have fun to some degree. Eh? You can see it's attached down to the muscle right in here. Trying to leave some of that fat. The fat's going to be good. It's going to help me, right? Boom. So there you go. Look at the appearance of the areola already. And the appearance of his chest is good. And all that's out. So that's 100% out. Let's just have some fun for a second and cut into this. You ready? Put that up here. And it's just going to be gland. It's white meat.
Well, that and his
You see that?
his came on so quick.
You get that? Now you get closer over here now. Woo. Yeah. So there you go.
Because like that all grew in 6 months according to him.
According to him, it didn't take a long time. So, and again, like I said, I left enough of this tissue around here, so I feel good about it. I might as well just put in my little stitch now while I'm at it.
Okay.
So I can look in here. I didn't do much liposuction. I'm okay. I don't really want to remove a lot of fat. I don't feel like there's going to be a depression or anything. I don't necessarily have to remove that water that I put in here. So I'm grabbing. You can see this good stuff. This is all good stuff. Yeah, show me.
I
Just left a lot of the fluid in there for you guys. But anyway, I gotta grab a bite of this and a bite of this. Taking 2 bites. That upper bite there. There we go. There she blows. And this is just to fill in the space where it's not just, it's a big deal. This is how you get to remove all of the tissue and close it up so you don't have a depression. So I guess we do so much of it, sometimes we get cavalier, but it's a BFD. BFD means this is how I preserve everything. And artistically, I'm leaving him with the fullness that he had in his chest because he has a nice chest. Don't necessarily have to go hog wild, just do what I need to do. Ultimately, it's how much I remove and how much I leave. How much I live is important, but how much I leave is important too, So look at that. I'm happy, totally happy. Nice chest. Now the idea is I got to get the same thing on the other side, but we'll see how that works out.
I imagine pretty good.
Oh, listen to you. Well, Micah, my videographer, and then I can feel the mass. It's right here. You can see how it's stuck. That's why he actually has inverted nipples. Look what happened over here. See the inverted nipple?
Yeah.
What happened to that?
It came out.
It's splayed out. Why? Because it's not held down. Remember, gynecomastia starts right below the nipple and it pulls down. So all this mass was sitting, right underneath the nipple.
And it taps
And
it.
it was just pulling it down, And this is hard.
Pulling and pushing.
Yeah, and this is hard.
It was pushing it out this way, but this was tacked down this way.
Yeah, hard stuff. I mean, that's rock hard stuff.
That's a consistency that I haven't seen much of.
That one?
Yeah.
Well,
Maybe because
That's
you cut
bland.
it.
yeah, cut it
Yeah,
open.
he cut it open.
Once I cut it open, it kind of releases some of the little tethered areas and stuff. Again, pretty small incision at the bottom of the areola. And hopefully what you'll see here is the reason why you have to do it on both sides and on almost all cases. And again, I think I put that to rest too, so you guys spread the word quickly on Reddit and just amongst yourselves, I guess, that, I don't get the, hey, I only have it on one side, so is it cheaper or something like that? Nah, buddy, it's on both sides. And you have to actually be more artistic because you have to get it right. See, that mass on the other side compresses the tissues, And it's not like that one has a bigger rock than this one. Take out the rock and it's the same. Nah, it compresses the tissues, and there becomes a difference in the anatomy. So therefore, the idea is to get it symmetrical. And you can see me struggling with this nice, sharp, seasoned Stevens scissor, because again, if there's going to be gland, it's going to be right underneath the nipple here. And you see that inverted nipple is already gone. You see that? Look at that. That one's already out. So just cutting the attachments to the underlying tissue releases the tethering effect and therefore frees up the nipple.
Yeah.
Ooh. Doesn't have as much gland on this side. It's fibrofatty, which I would challenge all you guys, or all you people that are watching this, is where does gyno begin and where does it end? I don't know. I could tell, but I don't think we've really had these discussions, because how do I know I'm removing it all and all that stuff? Well, it looks like I could feel the perimeter of it while it's in the skin. And certainly in that case here, you could tell where it begins and it ends, because there's white and then there's not, whereas this is not so white, blah. So smaller, obviously. He's got some, obviously some of this is the white stuff, okay, but most of it isn't. Then it's a lot smaller than that side. Now as I look at here, I'm saying, okay, well this looks a little bit bigger over here, so I'm going to sculpt him a little bit here with some lipo. Not that much.
Hi.
And again, I'm just pulling out a lot of the water that I had put in there originally, But just a little bit, just remove most of the water here. A little bit of the fat, but not that much. Not going hog wild on there. That looks good, all right. And then you got the defect that's created from the removal. I could feel the fullness up over in this region here. And I could feel the normal tissue is right here. A little bit of blood. You got to make sure it's dry. Okay, that looks good. So you can see this tissue layer here. It's going to be a sort of a sandwich of tissue. Grab a bite of here. Good. 2 layers. Bite down there. And the funny part here is, you guys probably didn't notice this in the video, but we were out here doing the surgery and Michael was late as usual, coming in with his camera. And what he didn't realize is that I can have this done in literally no time at all. So on some of these cases, I'd say all of them, I can do these pretty quickly. I feel a little fullness right up here. I'm going to do a little bit more suctioning right here. One of the benefits of doing so many of these is that it becomes more like riding a bike. I still have a lot of fun doing these, and everyone's a little different, which is the good thing. Okay, so that helped a lot. That made that smoother. That looks fantastic. I like what I see. We're done. So that didn't take long. Before the videographer can even get ready here. Obviously, much bigger on this side, smaller on this side. Good symmetry now. Notice the immediate shrinkage of the nipple over the complexes are almost equal already, and they're only going to get better with time. Preserve some of the fullness of the chest. It's completely natural, given the definition that he has and wants and keeps. Okay. And then look at the inverted nipple condition already. So he had inverted nipple where they were stuck down. Look at this one's out like a hot dog there, and this one is out as well, but it's not as big as that one because this one was expanded. And so would I make this one smaller? No, that'll get smaller by itself. I doubt I need to do anything. And so just a classic asymmetrical or unilateral gynecomastia and how we make it as good as it gets.
Bingo.
Bingo?
Bingo.
Bingo dingo. Hello.
How we doing?
Good.
Good.
How's it going? Good.
Come sit up here. How was the night?
I didn't need any pain medication.
Really?
Took nothing.
Nothing.
Yeah, I'm just a little. Oh, I have the hiccups. A little sore
Okay.
today, but nothing bad at all.
Okay, good, good. Even soreness across your chest?
Yeah, it feels even. One of the pads fell out. I think,
Okay.
When I was sleeping, but other than that,
All
I
good.
didn't get much sleep. I have trouble sleeping upright, so I got like 2 hours of sleep, which is.
Oh, I'm
I'm
sorry.
gonna sleep on the plane, so I'll be fine.
Yeah, okay. Very good. All right, well, let's get to it. Okay, guys, so we're going to take everything off. This is kind of the way I see you guys when I see you guys back one day post-op. Everything's kind of disheveled. And that's okay.
Slept in.
Yeah, slept in, which is good. He didn't get much sleep, so his is less slept in. Keep your arms down. I'll help you. It's day one, so I still have them keep their elbows to the side. And we're gonna get him all rewrapped and dressings changed. And so he'll be ready to go on his flight home. All right. Okay, I'm gonna have you lay back right here and kick your feet up. You ready?
Yep.
Okay. And I'm gonna lay back just a little bit more. There we go. Sometimes people get dizzy when we take the vest off, so I always try and lay them back. If you're at home doing this, I would suggest laying flat completely. And I do want to do just a quick recap visually for you. So you remember what, you just saw here. And so the profile. Okay. Oh, I like this one. How's that?
Yeah.
Yeah. Good? Good, good. Okay. Let's take a look. He says, fingers crossed, no hematoma. I say the same. But this is the first time he's taking a look at it, right?
Yep.
Okay. Keep your head back for a minute. I want to show you. Just a second. Everybody's always excited to see. No hematoma. Dang, not even hardly any bruising.
Yeah,
either.
that's
That
actually
looks
real
good.
Day 2, day 1.
Yeah. Okay, I'm gonna show you guys something that you may think is gross, so turn away if you don't want to see blood. Does that gross you out?
Yeah.
Don't look at it. See, this is how much we see. This is the drainage. Okay, I'm gonna lay you back. You ready? Okay, you don't feel good? Okay. Have you eaten anything?
Yeah, I ate a lot.
Okay. Do you need a Sprite?
No, I'm good.
Okay, you just breathe. Do you want to see your chest? Would that help you?
No.
It looks good.
Wait, I saw the.
You
little
saw
bit
the
of
blood?
in there.
Okay. Sorry about that.
Okay.
But yeah, if we can just pan across his chest here, take a look at it. It looks great. It's more swollen on one side than the other because there was more work done. So
Yeah.
that's expected. But really and truly, he doesn't have hardly any bruising. So that's really good.
Okay.
And the swelling is pretty minimal if you ask me. But you can automatically see how he's definitely more symmetrical today. And that was the whole point of this, is to get symmetry for him. And he's going to do great in his recovery. He's going to be probably back in the gym in 2 weeks for sure, I would assume, because he's a gym rat, so that's good. And so, yeah, we've done what we came here to do. Get more symmetry. And you see these incisions are really small, nothing big here. These sutures will fall out in about 7 to 14 days. And they are absorbable, so nothing to worry about. And that is our result. I am gonna make sure he feels good, and then I will go ahead and take his photos so we can show you guys the before and after. And that's gonna be a wrap for this video because he does live out of state, so we're not gonna make him come all the way back here for you guys. So You good?
I could send maybe like
gonna
a
send it?
2-week like post video or something if you'd like that.
Yeah, that'd be
Micah, you
awesome.
heard?
Yeah.
That would be super cool.
2 or 4 weeks, that'd be.
Okay. All right.
Yeah.
Great. So yeah, we'll look forward to that, and we'll show you guys what we get. And otherwise, if you have questions, please reach out to us on our website, agc.com, and then you can also submit your virtual consultation there directly to Dr. Caridi, and Dr. Caridi is the only one that sees those, and he's the one who responds. You'll get a quote from us, and if you're interested, we'll move you through the process and help you along the way. Anyways, thanks for watching, guys. We'll see you next time. If only everyone was so lucky.